and welcome to another episode of Wellbeing at Work, a workplace options podcast. My name is Sarah Wood, and I am the Vice President and General Manager of Emerging Solutions here at Workplace Options. Workplace Options is committed to helping individuals become healthier, happier, and more productive, both personally and professionally, through customized whole person support. Helping people cope through challenges like cancer is a core part of our mission. In the face of cancer, people need more than just clinical support. They need human-centered care that addresses the emotional, vocational, and identity-based challenges that they face. It's this truth that inspired us to develop Cancer Care Compass, a holistic, human-centered, clinically guided program designed to support employees through the cancer journey, from diagnosis all the way through work-life reintegration. Driving this support is a dedicated cancer care coordinator, a single, clinically trained professional who provides consistent, compassionate, and personalized support through each individual's cancer journey. To ensure that this support is clinically sound, emotionally attuned, and vocationally empowering, each coordinator is trained by world-renowned experts in oncology and psychiatric rehabilitation, Dr. Deborah Mukherji and Dr. Veronica Carey, who I'm delighted to have with me here today. Hi, Dr. Veronica and Dr. Deborah. Thank you so much for being here today.
Hello. Hi, thank you for having us on your podcast.
Yeah. So I wanted to start out by asking you a bit about your backgrounds. I wanted to start with you, Dr. Veronica. Can you tell us a little bit about your background and how it informs the way that you train coordinators in recovery-oriented psychiatric rehabilitation practices?
All right, absolutely. So hello to everyone. As Sarah has noted, I'm Dr. Veronica Carey. I am an Associate Dean for Culture, Climate, and Belonging at Drexel University in Philadelphia, Pennsylvania, in the United States. I'm also an Associate Clinical Professor, and my subject matter expertise is psychiatric rehabilitation. I'm also the chair of the United States Psychiatric Rehabilitation Association. So I believe that I can share a lot about why it is imperative that we're here together today. Now, I can only understand the origin and sort of the mechanics, if you will, about cancer, which Dr. Deborah will most certainly divulge, but it's important to understand about why rehabilitation is necessary. It's sort of above the genome. So Dr. Deborah will be sharing a lot about what it is, and then I'll be taking people in terms of how to manage their lives in the community. So I think it's going to be a great conversation, and I welcome everyone to be here.
Thank you so much. Now, Dr. Deborah, as a practicing oncologist, how have your experiences shaped your belief in the importance of whole person, patient-centered care beyond the clinic?
Well, thank you so much for asking us to join this podcast and the whole program. As you mentioned, I'm a practicing medical oncologist in the Clemenceau Medical Center Hospital in Dubai in the United Arab Emirates. And we have a very diverse and actually quite a young population of patients here. So we have a lot of patients who are of working age, and it's a great interest of mine in supporting our patients through both their cancer treatment journey, guiding them through aspects of cancer prevention and screening, but also for our patients on treatment to be helping them to go back into their normal working life, their family life. So engaging in this program was also eye-opening to me at the strategies that we can promote in all of our communities to help our patients recover and to really have those survivorship principles supported in such a way as everyone has their optimum opportunity to get back into their normal life and carrying on with their lives after and during cancer treatment.
Fantastic. I wanted to pick up on something you said as well. When we were developing this program, there were kind of three things that pushed us towards knowing how important this issue is. One of them is that we know that cancer rates are continuing to increase. That's all around the world. We also know different structures and supports that are available do not necessarily make for equitable treatment and support. And one of the others was knowing that patients are becoming younger and younger. We are seeing instances of younger people having different cancers, more in that middle age, kind of sandwich caregiving age, where people might have young children, caring for aging parents, working, and then dealing with the diagnoses. And then lastly, really thanks to these major advances in treatment, survival rates and the overall cancer experience are improving all the time, which is great because people are, living longer after cancer, recovering better, but it doesn't always make for an easy recovery or really a smooth return to life or work. So I wanted to ask you both, what emotional, vocational, or broader psychosocial challenges do you feel like are overlooked once treatment ends?
I think in terms of once treatment ends, I think that's really looking directly at the individual, right? So
Mhm.
the coordinators are going to have to understand that everyone is going to have a different lived experience. So they can't end with one particular participant and then turn around and apply the same exact conversation to the next one. I think it's important to understand what are those dynamics, Sarah, that you just mentioned. Is someone on the younger end of having cancer? Or is someone at the older end where maybe they don't want to work as many years after returning to work as someone who wants to maybe work for another couple of decades after returning to work. So I
Mhm.
think the specialty of what we're talking about today and the competency within the coordinators is going to be the ability to view each individual as such, taking
Mhm.
their strengths, understand, listen in order to find out just how much support does this person need, how familiar are they for what they're about to enter or re-enter, and then what exactly do they need from that coordinator to be successful.
That's fantastic. That's fantastic. Thank you for that. I would also ask, is there any research or lived experience that either of you have that reveal about what survivors need for a seamless, lasting recovery or reintegration?
So I can definitely say that there's a lot of research going on, and the concept of survivorship or patients or individuals living with and beyond a cancer diagnosis is something which is growing because, as you mentioned, thankfully to many new treatments and screening, so we're catching cancers and diagnosing them early, we are curing more cancers. And that means that there is an increasing number of people in the community who have had a cancer diagnosis and are either undergoing chronic treatment or follow-up or have completed their treatment but still need to go under regular checkups. So we have
Mhm.
this increasing number of people in the community who are cancer survivors, which is absolutely fantastic. But
Yeah.
there is a body of research and many unmet research needs about exactly how, as a medical and an occupational workforce community, that we can facilitate going back to work, going back to normal life, going back to normal family activities, but also what survivors of cancer need. And this is, of course, incredibly individual, as Dr. Veronica touched on. Every case is different. There is no one size fits all. But we certainly can say that for common cancers, such as breast cancer, which affects younger women, there are a multitude of emotional and social and psychosexual results and impacts of treatment which need very careful management. And if we ignore all these things, then we're not allowing that individual to go back to their optional functioning in the community or in the workplace.
Yeah, I actually appreciate that, Dr. Deborah, because I was also thinking about the two words that Sarah used leading into your response when she was talking about recovery and rehabilitation. Dr. Deborah and I both do trainings around the world. I come out of the US and I travel broadly to help that with those two definitions. People oftentimes think that recovery means absence of, I no longer have cancer. Oftentimes persons might be living with, and again, Dr. Deborah, please elaborate, but they may be living with something that is an outcome of having their cancer. Or in my case, sometimes working with mental health population, they may not be, there's no cure for schizophrenia. So now how do we assist people to live with schizophrenia? And then the rehabilitation that we're working with the coordinators is literally helping people to see, how do I live, learn, work, and socialize in the community after cancer? So
Mhm.
now we have countries and cultures that are looking at, I never thought that was possible. So now that's the recovery angle. And then how do we assist them to function in the community? we assist them through addressing those 4 environments of living, learning, working, and socializing. So I think that's imperative to kind of mention at this juncture, because it's also going to be a thread throughout the rest of this conversation.
Mhm. I agree. Thank you so much for sharing that. Now, we've touched a little bit on the cancer care coordinator, which is really one of the things that we're here to talk about the most today. So, core to this program is our cancer care coordinator. This is a master's level clinician who has received this additional training from Dr. Veronica and Dr. Deborah, really to be able to offer broad support, navigate fragmented resources, and truly be that one trusted source for continuous comprehensive care. What do you all see as the major responsibilities of this cancer care coordinator when working with an individual with cancer?
Perhaps I can start to say that it was really an eye-opener for me actually being involved in this training, because we were involved in training coordinators coming from many different and diverse parts of the world. And they brought with them their experience and their cultural knowledge of how a diagnosis of cancer has the perhaps taboo or difficulties in expressing the meaning and the implications of this diagnosis in their individual communities. So having those cancer care coordinators embedded in the program from different parts of the world and discussing what cancer means to them was the beginning of our discussion and our training. And then, of course, we can't teach anyone every single thing about different types of cancer, but the main focus from my point of view was to help the cancer care coordinators appreciate how we must ask the right questions, that they must ask the right questions and their clients will need to ask the right questions to get all the information that's going to facilitate their individual recovery plan and their individual work integration plan.
Mm-hmm. Yeah, just to add to that, I like that because I like how you and I sort of like think in the same direction. So I might speak something and Dr. Deborah can continue. Because I'm thinking about the clinical care coordinators also. We were emphasizing that the client doesn't have to be perfect to go back to work, right? So they may outcomes of cancer, maybe they're utilizing an accommodation, or maybe there's a medication regimen that they're going to have to take while at work, right? So they may not be symptom free in terms of it's like a new normal, right? People always say returning back, and that's not always going to be, it's a new normal. And how is this new normal going to be facilitative, right? Help with facilitating the ability to go back and to work effectively. So again, those kinds of terms, the clinical coordinator can help kind of reduce that shoulder up moment where people are going to be anxious, like, can I do it? Can I do it? And I'm like, yeah, you can do it, but let's define how it looks now. It may not look like it did a few weeks ago.
Yeah, and I think that's a great point too. And what we're seeing often in the program as well is people who haven't even taken a leave from work or are not taking a leave from work. So those accommodations or that medication schedule, it's really about discussing what can you do? What are you still capable of? How do you discuss and advocate for yourself within your organization to make sure your needs are known? But that is a trend that we have seen also. So it's not as simple as taking a leave from work to get treatment, but it may also be working through treatment and adjusting, what you're capable of throughout that journey.
Absolutely. I think for employers who are considering making this program available to their employees, it really sends a very clear message that their employees are valued. It means that they're maximizing the retention of their staff and the ability of their staff to be reintegrated back into the workforce whenever possible, and to have those specific accommodations and support that are needed to bring those individuals back to full functioning in terms of their occupational life, and that also helps them in their social functioning. Their recovery from treatment may even be quicker if they have that support from their workplace. So I think that it really sends that very strong message that individuals and employees are valued for what they can bring to their workforce, despite any accommodations that need to be made. So I think that this is such a positive program for everyone, both the individual and the team and the company in general.
Right. And the clinical coordinators were also exposed to a theory by Malcolm Knowles that talks about andragogy. Usually individuals are familiar with a pedagogical posture, but once people reach adulthood, Malcolm Knowles talks about how andragogy says you have to involve the adult in that process. So the clinical coordinator should be asking a lot of questions so they can facilitate what is necessary. They shouldn't be making assumptions. They can't impress upon them what they want them to do if the client is not going to want to do that. So the andragogical approach says, listen to the lived experience, ask questions, be supportive, and then offer that readiness to learn that we mentioned earlier, because that new normal is not a vision that the person's had. They had an old normal. They had a prior to cancer normal. This new normal is going to be amazing if the clinical coordinator approaches it with hope. And like we talked about, I call this the F word, functioning in the community. That's the goal. The clinical coordinators want the individuals to be successful when they're not around. And the approaches that we're talking about today and that we had educated them upon will allow the person to be successful when the clinical coordinator is no longer there.
Fantastic.
Absolutely. And it's not just the individual client, but it's actually the whole of their working environment. So it may be their manager, it may be their co-workers that also need support and need to know how this particular situation should be approached, how to support that individual in the best possible way. Because if we're valuing everyone's contribution to the workforce, we can also recognize that someone going through a severe illness and treatment can actually have even more valuable insights when they're going back to their work. And many of my patients tell me that cancer actually gave them something. It gave them a different perspective. It gave them a different drive. So these are very valuable things to reflect back on the managers and the teams, that this can be integrated in a very clear and positive message for everyone.
This is fantastic. Thank you all for sharing that. Now, I see the way that you two work together here, just speaking on the podcast, but I'm curious how you were able to weave together psychiatric rehabilitation and clinical support in a way that supports the whole person as you were delivering the training to our cancer care coordinators.
Oh, isn't that a great question? Because the pervasiveness of psychiatric rehabilitation, and it talks about the 4 environments that I mentioned before: living, learning, working, and socializing. So it wasn't a huge leap to be able to deliver the psych rehab principles into this training. The idea is that cancer survivors are living with, right, the new normal that we talked about earlier, the functioning, the absence of the practitioner, the practitioners approaching them as adults as they are. There are 4 impacts that happen when someone has a severe or persistent diagnosis. One of the impacts, of course, is looking at impairment. So what has happened? What am I impaired by this? Well, somehow I have been. And then the clinical side will help to address those kinds of things. Another one is dysfunction. Is there anything maybe perhaps that I do need an aid for? Maybe I do need a crutch or a cane or a wheelchair, or maybe something visual or a brace. Maybe that is something different that I will have to utilize to be successful in the future. But the last 2 that Dr. Deborah talked about in terms of community and even the workplace, those 2 talk about society. So how are we going to assist with people that are, almost every country has a word for it, disability, right? We have disabled, right? Well, dis means not, right? Disabled means not able. So now we're going to be educating the community that yes, people and workplace options will be able to demonstrate that individuals who complete this process will be able to go back to work. So now we have a different cultural definition of disability. And then lastly, we have disadvantage. We have to stop holding back and keeping things back from people that are surviving different things, thinking that they're not going to be able to do the work. So many outcomes that will come from a rehabilitative perspective once the clinical issue has been, gotten to a point where someone can do the work, can go back into the office place, and then the community will see it differently. So it's a win-win that Workplace Options has offered this in several countries.
Mm-hmm.
Absolutely. I'd like to share something about this cultural realignment, which is here in the UAE where I work. There's nothing called disabled. There are parking spaces which are specifically for people of determination. So that description, people of determination, really reflects the positive way in which this is viewed, because you can reflect on the fact that people who are perhaps, not of the same mobility as others have been through something and are thriving and are living their life, and they need parking spaces. So this description is really a reflection of that cultural change in viewing people of determination and recognizing the fact that they are valued in society. And this is what this program is doing in the workplace. You're saying that, okay, this person has gone through something, is going through something, they need some particular support. And this way they are valued, and this way they are returning and thriving in their workplace, in their community, and being able to give everything that they can.
Wonderful. Thank you both so much. Now, Dr. Veronica, I'm hanging on a little bit to that LLWS model of support that they're utilizing, thinking through helping people in the different dimensions of their life, living all about kind of balancing that energy, the different energy resources you might have as you're going through treatment or after treatment that are different than what you had when you started your journey, working that reintegration or accommodation piece. And the social piece, I think, is really interesting as well. From what I understand, cancer patients have a tendency they can self-isolate and in some cases, experience some issues from being more isolated and kind of keeping that story to themselves. And one of the things I think is really special about that social piece is helping people reconnect both with colleagues, but also with friends, family, and loved ones, and almost navigate their disclosure story, help people figure out what they feel comfortable with, how to share that story.
Right.
And it might look different in the different facets of life. So I just think that's very unique and special as well.
I think what's also important to realize, Sarah, is that these are the same environments that we live in.
Mm-hmm.
So it's not taking, persons that have a diagnosis and applying living, learning, working, and socializing. The clinical care coordinators understand that this is what I do. And perhaps I can bring some leverage to the conversation about it because I'm doing it every single day as well.
Mm-hmm.
Now, maybe work is a focus, but as Dr. Deborah had even mentioned before, social, learning, and living will impact that day. Mm-hmm. If I am a mother trying to get to work and my child is ill, then I'm going to have a difficult time getting to work, or maybe I'll be a half an hour late, or maybe I can't come in at all, right? Or maybe there's a learning component that I need to address by getting a certification or a different license in order to go back and retain the job that I want to have. So we deal with these four environments. It's called life, and it doesn't just apply to individuals who are utilizing services.
Mm-hmm. Yeah, I think that's fantastic. And I know that cancer changes more than just your health. It can disrupt your sense of self, your future plans, your role at home and at work. And that recovery support really needs to address those deeper layers, and that identity disruption and role disruption can be very, very challenging and very complex for individuals. So I know we've touched on that a little bit on the surface, but I wanted to ask on a deeper level, how do you see identity-centered support improving both emotional recovery as well as health and workplace outcomes?
I can certainly start with some of the potential physical effects of cancer treatment, which, as we mentioned briefly before, are incredibly varied. So what we did with our training methods is really to help the cancer care coordinators to ask the right questions, to help the clients ask the right questions about exactly what to expect during and after their treatment, what the expected physical effects and lasting effects would be, the timelines, the follow-ups, all those different things have a very unique plan for each patient or each client. but certainly impacting the return to work, impacting the expectations of the time away from work. This is going to be very, very individual depending on the type of cancer, the type of treatment, and the duration of treatment. And as we mentioned, that we have our patients who are sometimes not cured, but are living for many, many, many years with the cancer diagnosis and on treatment. So these situations may change, the clinical situation may change, but having all that information on hand and having that very strong dialogue between the patient, their treating team, and their employers is going to maximize the ability of that person to be as functional as possible for as long as possible, but also to help them, as you mentioned, with their family and social, and emotional well-being. And we often find that even if a patient is ongoing with their treatment, if they can work and they can continue that normal or the new normal that they have, this actually is really very beneficial in other aspects of their life.
And Dr. Deborah, please tell me that term again, for not disabled. What is the?
People of determination.
People of determination. I love that. It's like a t-shirt waiting to happen. I love that. I love that. I don't want to get too far away without celebrating that, because I think, newly abled, there's a lot of different, synonyms that are kind of coming out. But also, Sarah, brings me back to the question in terms of when you were talking about how did we deliver this training and how did we organize it, et cetera, to reach those three outcomes that you mentioned, right? Increased knowledge about cancer, making it equitable. People are, younger and younger that have the cancer diagnosis. And when Dr. Deborah and I decided, how are we going to deliver this? Like, what's imperative to go through first? And we decided that understanding cancer was very much important first. So that was the first deliverable as a part of the multi-day training. It's no point in talking about it if we don't know what it is. So I benefited greatly from having that be the first part of the training. And the style of the training was articles. We had sort of like, online virtual like role plays throughout the trainings. And we also had vignettes. So people could read potential conversations that they may have with the clients in the future. And the clinical care coordinators could in vivo, in the moment, process what they're going to be able to say, because they're not going to be able to take it home, think about it, and come back and tell the client. They're going to have to be, that reciprocity is going to have to happen. So we tried to minimize any anxiety that the clinical care coordinators would have in this role, right? We want them to be able to deliver it in a way where they felt comfortable, having already done several exercises and were given several resources. And they have the PowerPoints to go back and maybe look at terminology about cancer and or about rehabilitation that may not be familiar with. So they have the resource to go back and support them.
Yeah, that's fantastic. Now, I wanted to move on a little bit to kind of the organizational level of things. So truly supporting employee well-being, really in the face of challenges like cancer, it takes more than good intentions. It takes thoughtful design, expert guidance, and a commitment to the whole purpose. And Cancer Care Compass really delivers on all three of these. This was a very thoughtfully designed product, took over a year to scope and design. Part of our work was speaking with cancer survivors. Part of our work was speaking with experts like Dr. Deborah and Dr. Veronica. And part of our work was speaking with organizations and managers who have worked with cancer survivors and had cancer survivors in their population. So I wanted to see what your thoughts are on sharing what was kind of behind the scenes, what input you had into developing and refining the program as it exists today.
So perhaps I'll start that, it was really something very new to me to be involved in this type of process. But as we've mentioned, my role was really to find out from the cancer care coordinators from different parts of the world what their experience was in their particular communities, and then build on that to give them not just knowledge, but the ability to ask the right questions. So it was certainly a great pleasure to be involved in this training process, because it's something so important to what we do, and it could be incredibly impactful for the individuals who get access to this type of support. So in terms of designing the training, it wasn't, as Dr. Veronica mentioned, this is not supposed to be didactic teaching. This is what cancer is. We can never answer all those questions, but it really is a way of thinking. It's an insight into the information that needs to be gathered, the types of support that might be needed from the clinical perspective, and then assisting the coordinators to really be able to package and communicate that complex knowledge into a very helpful, practical management plan, list of questions. What information do we need? How can we best help? And how do we proceed with the work integration plan?
Mm-hmm. And I think to add to that is that we also took heed of health inequities and health disparities that happen, right? So if we're looking at it saying everyone that has cancer or living with cancer or no longer is living with cancer, but returning to work after cancer, there are different dynamics that are going to happen in the workplace. Oftentimes, there's some sort of view of what they're going to be like when they return. Why? Because people haven't been educated about what that is. So when people are returning and productive and they're functioning and they're successful, and again, successful doesn't mean perfect. People have days off during the week for a reason, vacations during the year for a reason. So we encourage the clinical care coordinators to assist people to say their lives aren't going to be like this once they return. It is going to have ups and downs, right? It's going to have exacerbations and remissions. They have to understand that. So when the clinical coordinator is speaking with the individuals, that visual can help, again, minimize those shoulders, the anxiety that's going to come with not being able to know how to respond. There's even role plays for the client to say, what could you say back if this happens? And give the clinical coordinator the license to say, that is rehabilitative. Those kinds of conversations are necessary. The adult learner will usually just kind of smile and nod. Yeah, not a problem, not a problem. And inside, they have no idea how to satisfy the question, but they don't want to be called out as an adult. But in rehabilitation, the clinical coordinators are pretty much saying, please tell me what you don't know. Please tell me how I can help you. Because the amount of time we have together, I want it to be exactly as you require. And I think that's a very unique approach. And I think it's one that should be duplicated across other services.
And I know this is something we spoke about earlier on in the podcast, but the fact that this is a flexible member-led journey, I think is so important because some individuals might need more support in the beginning phases of their diagnosis and treatment, right? They might need really support with thinking about how to tell their story, how to figure out how to manage all of their different roles and responsibilities, how to think about approaching their employer with that conversation or having those initial conversations with their managers. And then you're right. I think anyone who's ever taken a leave from work, whether it be for a medical illness or caregiving, just because you plan does not mean your plan is going to come to fruition. Life happens, things change. And so I think that value of support throughout might be heavier on the back end for some people. They might need a little less support through that initial journey, but then they come back and things are very shaken up. It's very different. Things have changed, plans have gone awry. And so how do you reorient, again, as you said, redrop your shoulders, lower that anxiety, and help someone move forward with their new normal or what they're facing right now?
Absolutely. And as we said, that just having this support available is giving that clear message that that person is valued, that their skills are valued, that this new normal is still valuable to their company and they are being given the support to thrive. And it's also helpful for that workplace dynamic as well, because there is a lot of fear around a cancer diagnosis. There's a lot of unsaid questions. There are a lot of subjects that people would not want to talk about with their colleagues and co-workers. So as you said, navigating that story, navigating the support, navigating how the colleagues and the managers are being given information and can be assisted in this particular client's workplace. So important. It's not one individual, it's the whole dynamic of the workplace.
Yeah. And another essential component, excuse me, of rehabilitation is what I call remaining vertical. And I cannot tell you how many times I've done this around the world, but not persons that we're talking about as clients, but every living human being wants to be vertical. When we don't feel well, we want to go horizontal, right? So we need to get people up to the point where they can function in our absence. And we do that three ways. The environment is what they're going to be entering into: living, learning, working, socializing. But we also need to be cognizant of, well, how do I do that? How do I sustain myself? So rehabilitation speaks to three ways: skills, and we've used these words today already: skills, resources, and supports. The thing that you have the most of are skills. Resources are things you use to be successful, like maybe a phone or a train schedule or the TV to tell you what the weather is going to be for that day. Supports are things that are more innately emotionally connected, like family members, peers, pets, right? So if we want to have a balance, the balance is to come that all three of them are required in order to live our lives. But what do we need the most of? Are skills. So oftentimes when an individual is talking to the clinical care coordinator, they don't know what skills that they need. They don't know maybe how to address discussing what my cancer is, if someone asks them about that. Or maybe someone might see them administrating a medication regimen that's necessary, and they might have questions about that. How do I respond to those kinds of things, right? What resources do I need throughout the day? Even something as simple as packing a lunch might be a resource, or having the money exactly so you can get onto the public transit or driving your own vehicle. What supports do you need when the day is over? Who can you kind of de-escalate with, right? Who can you talk with? So the clinical coordinators also listen for when the client asks for something. Are they mentioning it? Are they minus support? Because the clinical coordinators have a time frame and a work day. So if someone needs something at 2 a.m., it should not be the clinical coordinator who gets the call. It should be someone probably on the support side of things. So they have to make sure that these things are inherent before they leave them. Because if someone's going back to an environment that's unfamiliar, they have a new normal, it's very hard to think that they're going to be able to do this in the absence of having support in the community. So those supports need to also be drawn upon. Do you have this? If not, how can we help you establish this from a peer network or community resources or religious resources so that you have that support, those resources and those skills, and then it'll help you be successful.
I think that's a great point. It just goes so much deeper and is so much more holistic than you would think. And I think that's what's really unique about the program as well, is just that this cancer care coordinator is able to do that holistic listening, help find community resources, take those things off of someone's to-do list. So if someone's juggling many hats, maybe they need help with finding childcare, maybe they need help with financial assistance, maybe they're looking into complementary therapies or alternative treatments to complement what they're doing, looking into a nutritionist, different things like that. We're able to listen for that, take that work off of their plate and connect them with local resources, but then go so much deeper, again, with those actual vocational reintegration coaching sessions. As you said, prepare them for times when they're in need and maybe, they have to think about who the circle is that they're going to reach out to, thinking about the ways that they're going to tell their story. A big one for me as well is helping them manage energy. The first time I learned about spoon theory and the ways that things like spoon theory could really interact with balancing energy and helping people with chronic conditions like cancer get through their days, I thought that was just revolutionary to use in this context. I was wondering, Dr. Veronica, if you could say a little bit more about that energy management and balance and spoon theory and how they use that tool.
Well, you know what? I don't even feel as if I am competent to fully address spoon theory. But I know that in essence, it's talking about how people navigate what they have and what's missing. How can they employ it, right? And the best way to do that is to understand, first of all, what is my final goal? If my final goal is literally just be able to get through a day. I mean, it'd be great if I make friends in the office. It'd be great over time if I can navigate spaces differently. But maybe for the first 3 months, my goal is to not be absent, right? So then where do I draw upon how I can do that? Where do I get that from? And if those kinds of questions can come into the clinical care coordinator, then the image is different, right? Like I said, not everyone's going to be the same need. The next person who gets on the call may say, no, I'm good with that. I want to know, right? So the ability, again, I don't feel competent to address spoon theory. I know of it, but I don't like to speak too long on things that I don't have strengths in. But I know that they are, they're in unison with everything that we have been speaking about today. We have to understand overcoming doesn't mean without something. Overcoming means navigating and managing. And that's where your strength and energy can be found. We have to rename things sometimes. And Dr. Deborah, not to play something on you and get away from this, we can go back to spoon, but I know that we talked about comorbid disorders too. So quite possibly people might be dealing with more than one issue or concern as they go back to work. And maybe you can talk about that. Maybe we could answer Sarah, but I know that that's important as well.
Absolutely. And this is why the emphasis of the training was that every person is an individual, every treatment is individual, the expectations of their recovery will be different. And you mentioned comorbid conditions. These could be pre-existing medical conditions. These can be medical conditions that come up as a consequence of therapy. And that's becoming more and more common when we're using different types of therapy for cancer treatment, such as immunotherapy, targeted therapy. We're having some long-term side effects which are not related to the cancer, but are related to the treatment. And these can be related to hormonal changes. They can be other conditions which the person wasn't dealing with before, but now is dealing with something extra. So these are all things that are important to understand from the client's point of view, from the employer's point of view, from the team point of view. And they will be different for every person, but they can be just as impactful as the cancer itself. So this is a very important aspect that will need to be discussed, and the information will be needed to be clear both to the person and their coordinator and their occupational team. And also just to make a point that sometimes the most impactful issues for a certain person are not the ones that the doctor is addressing in the clinic. So as the oncologist, we may be seeing the person every 3 months for their follow-up and saying, yes, your scans are fine, your blood tests are fine, everything's fine. And our patient is sitting there not telling us that they're having all sorts of psychosexual problems and related to their therapy. They don't want to reveal, or they don't feel comfortable in revealing. They don't feel comfortable in certain things which they don't feel they can discuss with their clinician. But actually getting to the bottom of those issues and getting support will be vital to their occupational rehabilitation and their occupational functioning.
Thank you for that. That's a great point as well. I feel like we've covered a lot of the different special and unique things about this program, but I wanted to also ask, how do you see a program like Cancer Care Compass transforming the future of cancer care and workplace well-being? Why do you feel like organizations should view this as an investment in their future?
Perhaps I could start saying that this is something very unique. It's something really groundbreaking, and this is something needed perhaps for all workplace environments in the future. There's a growing realization that cancer diagnoses are becoming more prevalent, but hopefully cancer is becoming more curable. We're having younger patients being diagnosed and surviving a cancer diagnosis. So this is something which is going to be more and more of an issue in the modern workplace. So this is really a sort of trailblazing program, and sets some of the standards which I think will be adopted by many, or should be adopted by many workplaces, both now and in the future.
Yeah, I'll add to that, because I think you actually used words that I was going to use, so I don't want to duplicate what you just shared because it was perfect. But I also add that this is a training and an approach and an outcome that is so multidimensional. It looks at what does the workplace need, and Sarah, you mentioned earlier, in dialoguing with so many people to make this training necessary and needed. And then it's celebrating the clinical care coordinators for the strengths and competencies as they're bringing to the conversation. These are already skilled individuals, and we're asking them to apply those competencies in this setting. So we're already acknowledging and celebrating that we got information from the community for what's necessary. We're bringing in individuals who, in essence, are volunteering, right, their current strengths and capacities and expertise and applying it here. And then that energy and that drive is felt then by the clients, almost to say, you can do it, you can do it. It's like the train is kind of pushing towards them. They can feel that support, right? That we know these outcomes are possible. We're going to get each one of you to that desired point. So I think the actual training in and of itself has so many celebratory moments. That's why I think it's going to be successful. That's why you can see outcomes with the clients, because along the way, we're not telling clinical coordinators, forget what you already know, learn this. No, we're saying, bring everything you know, we're adding to this. And that way, when because clinical coordinators, and Dr. Deborah, you might have your instances too, where they were asking questions that were like, can I shift back and answer people from this perspective? Would that be wrong if it seemed more clinical to them than rehabilitative? And the answer is no. Whatever they require to be successful, you can answer them as. If it's something for which they need to be referred back to a more clinical entity, then absolutely make that referral back, because your drive is to help them function when you're not around. But if you feel as if you can in the moment respond, absolutely. So it doesn't strap the clinical coordinator from using their expertise and their time in the field to help the outcome of the clients.
Absolutely. And I think having that individual support, that relationship, which will be an ongoing relationship with a person who has that training, will be beneficial to the individual and to the teams that they work in, as we've mentioned. So I think this is such a unique program in the fact that it's very individually person-centered, and it's something which could really open the door to a great culture change in terms of how cancer in the workplace is viewed in a very positive aspect, which is what we're promoting.
And believe it or not, Sarah, nothing was offline during these trainings. Clinical coordinators could ask questions of either of us at any point in time. And again, I think Dr. Deborah and I have the educative competencies of making things visual, so that they could see how they can be successful doing these different things. We would explain a concept, but then we'd give them something to be able to view, like I mentioned earlier, through the role plays or vignettes or the articles, so they could see that, oh, I can do this. Watch this video, and then come back and answer these questions based on this video. Oh, I see that I can emulate and I can copy what I just saw in this video. So again, I think that the construct of the training, the necessity of the training, and knowing that people can be successful, it's a win-win.
Wonderful. Well, thank you both so much for your time today on the podcast. Thank you for all your work on the amazing Cancer Care Compass program, and just all the work you're doing in your fields around the world, helping individuals. So thank you again for your time. And thank you for those of you who have tuned in. If you want to learn more about Cancer Care Compass, please go on to the Workplace Options website and read ahead. All right. Thank you so much, everyone.
Thank you.